Hi, it's Dr. Claudia Kim again. Let's talk about the nose. Because even small changes here can have a big impact on the entire face. So the nose sits at the center of the face, so it plays a major role in overall balance and in how masculine or feminine someone appears. When we talk about changing the nose, there's really two main approaches, and that's surgical and non-surgical. So with surgical rhinoplasty, we're shaping the underlying structure of the nose, the bone, the cartilage, the fat. And that can include the smoothing of the hump, or refining of the tip, or adjusting the projection, or changing rotation. There's a lot of different components to the nose, I bet you didn't know. For a more feminine appearance, patients often want a softer bridge, a more refined tip or a sharper tip, and sometimes a slight upward rotation, or kind of like that perkier nose tip. For a more masculine look, we usually preserve or even enhance that straighter, stronger side profile. Surgery will offer permanent results, which is the big advantage, but it also comes with the downtime and the healing. So that's where non-surgical rhinoplasty comes in, using filler. And you can sometimes hear that referred to as liquid rhinoplasty. And with fillers, we can make more subtle adjustments. So we can also smooth out the small bumps, we can improve symmetry and create that straighter profile, and even give the illusion of a narrower nose or more refined nose, to a certain degree. And in some cases, we can also subtly adjust the tip to create that small amount of a lip. But it's important to understand, filler doesn't actually make the nose smaller, like in a surgical rhinoplasty. Instead, it's working by camouflaging and balancing and playing on light. I often describe liquid rhinoplasty as kind of like contouring makeup for the nose, where you can actually use bronzers and highlighters, which is using light and shape to change how the eye perceives its structure. And this makes it a really great option for patients who want subtle refinements, or those who want to test a look before actually committing to surgery. But at the end of the day, the right approach really depends on your goals, your anatomy, and how much change you're looking for. And when it's done thoughtfully, even those tiny small changes to the nose can really bring the entire face into better balance.